my colleagues at the Population Council did a large study in Uttar Pradesh and Bihar that studied adolescents across the two states in a huge sort of state representative survey with very large samples. And one of the things that emerged that really struck us was that when we looked at girls and boys reporting that they had, and these are unmarried adolescents, reporting whether they had any of these symptoms of STIs as we know them or RTIs, they had an equal proportion of boys and girls reporting that they experienced symptoms, yet 2/3 of boys sought care as opposed to only a quarter of the girls. And that was a pretty stark, reminder of it's not necessarily access, but who chooses to go for care. And even when we dug deeper into where they sought care, we found that girls and boys sought care totally differently. The boys tended to seek the chemist or the private sector, where the girls were using more clinic-based care. Could be for a variety of reasons, but it's important to realize that these patterns are different, but girls were definitely seeking much less care. And I think what research has shown us over the years with adolescents in particular is that the shame, the ability to feel comfortable with a provider is really critical. Even if a woman is sexually active, is the provider going to be sensitive to that, or is she going to feel worse about going to seek care? Again, as we get older, and I recently looked at the National Family Health Survey to look again at women's treatment seeking for these same symptoms. And you find again there are incredibly low rates of seeking treatment, but it really varies state to state. But, on average, let's say maybe 2 out of 5 may seek treatment, depending on the place. So the barriers, again, from all of the years of research that's been done by many people on the ground, speaking to women themselves, typically relate to either the difficulty, the shame, the embarrassment, the sort of culture of silence around women's non-maternal issues. So if there's white discharge, if there are other symptoms, they don't know how they'll be treated. But then there's a second really important one. Can the system even respond? Is there a doctor, a female gynecologist, for example, or a female nurse who can be available and respond to these? So I think they're both about the access of appropriate services in the system, as well as, women's own fears, because the culture that's been created around these issues.